Lancaster County is a combination of both rural and urban areas. It doesn't have its own health department. Recognizing that there's a significant public health gap, the Partnership for Public Health was formed in Lancaster. And that nonprofit, along with the Lancaster Lead Coalition, tries to address some of the key public health issues in Lancaster. Rich Pepino, the Deputy Director of the Community Engagement Corps, was invited to be part of the Lancaster Lead Coalition in 2012. We worked with Lancaster epidemiologist Michael Horst to understand the data on lead poisoning in children, revealing very high prevalence in the Hispanic and Amish communities. Rich Pepino and I met with doctors from the Clinic for Special Children who care for the Amish community, but had not been testing most children for lead. We explored some very unique exposure scenarios in the Amish. They have a tendency to do a lot of recycling. They refurbish furniture, often in home workshops, making that lead dust available, unfortunately, to children and pets. We worked with groups of nurses, the Nurse Family Partnership and others, and we engaged with them to enhance their environmental health literacy around lead, hoping that they would, as they worked with individual families, carry on that mission. We engaged with other primary care and other doctors in Lancaster County to encourage them too to test more children. In the urban areas, Lancaster was once the most western commercial site in the Commonwealth. Its long history of commercial and industrial property use has contributed to lead in the soil from nearby zinc mines, whose ore came to Lancaster by train and whose mine tailings were used as a bed for the train tracks. Local lead smelters and paint manufacturers also contributed to lead in soil. Rich Pepino held numerous lead soil testing events in Lancaster, sometimes involving college students at F&M and also Penn. Engaging community members around soil testing for lead opened the conversation about other sources. 85% of the housing stock in Lancaster City is older than 1978, which makes it a potential lead hazard. In the poorest neighborhoods of the city, childhood lead poisoning rates were more than double the rates in other neighborhoods. The Latinx community was particularly impacted. The CEET, together with the Lancaster Lead Coalition, provided data to assist the city in their efforts to secure their largest HUD grant to remediate homes for lead in 2019, $11 million. In 2017, our Community Engagement Corps provided a legislative briefing which helped secure passage of an ordinance making rental properties lead safe. Our collaboration with the Lancaster Lead Coalition increased awareness of lead poisoning in Lancaster and motivated a number of other actions, we believe. Lancaster General Health had become part of Penn Medicine in 2015. In 2021, Penn Medicine announced its commitment to residential lead remediation in Lancaster to the tune of $50 million over 10 years. That's a level of commitment that a health system has never before made to the residents of its community. We've seen how community engagement enhances awareness and leads to unpredictable outcomes. We pledge to continue to work with Dr. Jennifer Brubaker, who is the current chair of the Lancaster Lead Coalition, to continue to enhance the very important work that they've been doing in Lancaster to reduce lead poisoning among children.